Hello, everyone. I hope you're all having a wonderful day. My name is Sophia Al Hassan, and I'm honored to be your host for this webinar. I'd like to welcome you all to yet another exciting webinar under the Career Guidance Series United States Fellowship Track. For those of you who don't know what Alfaisal MedHub is an initiative under the umbrella of the International Office COM that aims at creating an online global community of medical students. Alfaisal MedHub covers a broad range of topics that are common to medical students all around the world. Our primary objective here at Alfaisal MedHub is to help medical students learn more about the career opportunities available after graduating, as well as the steps involved in pursuing them. After conducting a series of webinars on the various milestones of the application process of pursuing residency in the United States, we now hope to shed light on the various subspecialties fellowship pathways. Fellowship is the very next step of medical training after residency for many, and although there is considerable knowledge among students and prospective doctors about residency in the United States, the journey from being a resident to becoming a fellow and consultant remains relatively vague. Hence, our series aims to gauge medical students, graduates, and residents on this pathway and provide a guide to successfully matching into different subspecialties, making the process smoother. All of the webinars will be delivered by distinguished Alfaisal alumni who have successfully matched into their dream fellowship programs after residency. We are truly honored to have these renowned individuals who have embarked on an incredible journey throughout their careers on board with us to deliver these webinars. With no further delay, I'd like to introduce you to our dear speaker for today, Dr. Ahmed Shamia, who will be delivering the webinar titled Pursuing Surgical Subspecialty Fellowship Training in the United States. Dr. Ahmed Shamia is a graduate of the first batch of the College of Medicine at Alfaisal University. After graduating in 2013, he completed his general surgery residency at Harlem Hospital Center at Columbia University, New York, USA. Dr. Shamia then completed a burn surgery fellowship at Jacobi Medical Center at Einstein University, New York, USA. He also pursued an advanced laparoscopy bariatric surgery fellowship at Cleveland Clinic, Ohio, USA. Currently, Dr. Shamia is a general and bariatric surgeon at John Hopkins Aramco Hospital in Dhahran, Saudi Arabia. Thank you for joining us today, Dr. Shamia. We're looking forward to this informative webinar. You are welcome to begin when you're ready, but before we start, I'd just like to make sure if you would like to have the questions towards the end or if you'd like to answer them as they come.
I'm honestly okay with either. Whatever you guys prefer, I am happy to take.
Okay, so the doctor will take questions as they come and also towards the end.
Okay, so it's my pleasure to be with you all today. I'm Ahmed Shamia. I'm a general and bariatric surgeon here at John Hopkins, Dhahran. And this is a just introduction into what surgery fellowship application process looks like. So let's start with the outline. So we'll talk about career pathways for general surgeons, some ACGME accredited fellowships, and some other fellowships that are non-ACGME accredited. We'll talk about some of the match services or how you apply to these fellowships, examples of the timeline, and then some IMG alternative pathways. So these are examples of the ACGME accredited fellowships. We have cardiothoracic surgery, which is typically 2 years fellowship. There's a cardiac component, there's a thoracic component. Some of them are cardiac heavy, some of them thoracic heavy. So there are variations of these. There's a colorectal surgery, ACGME accredited, it's typically 1 year. And there's pediatric surgery, it's typically 3 years. And obviously pediatric surgery, the pediatric surgeons treat newborns until like 14 or 18 years of age, depending on the country. Surgical critical care fellowships, these are typically 1 year. And there is also complex general surgical oncology. And this is typically 2 years of training, involves all sorts of abdominal oncology, hepatobiliary, colorectal, gastric cancer, and other sorts of cancers. Vascular surgery, this is a 2-year training fellowship. It has a board on its own, and it can be pursued right after general surgery, or it can be an integrated residency, typically, or integrated training. It's typically, if it's an integrated training, it will be 3 years of general surgery, followed by 3 years of vascular surgery training, and the applicants then sit for the vascular surgery board, not the general surgery board. This is a list of the ACGME accredited fellowships. It's not necessarily comprehensive, or does not necessarily include all of them. This is most of them. And we were talking about vascular and plastic surgery. These both fellowships can be done after general surgery, or they can also, and currently there are integrated surgery training pathways for plastic and vascular that you would pursue right after medical school. It would cut some of the training time, because if you did plastic after general, you're doing 3 years after 5 years of training. If you did plastic as an integrated program, you would be doing 6 years. Both have, benefits and drawbacks, but it is one of the pathways that can be taken. There are other fellowships like hand surgery, hospice, palliative medicine, that are also ACGME, or they have a board that can be taken. So some of the other pathways that can be taken by general surgeons after training, these are typically non-ACGME accredited, or typically they don't have a board for them. So you finish the fellowship as training, there's no board to sit for. This includes transplant surgery, and this is mostly abdominal transplant, kidney, liver, intestinal transplant, pancreas, and then minimally invasive surgery. And this is typically done through laparoscopic means or robotic means nowadays, or both of them, and it can be further training in inguinal hernias or ventral hernias, or foregut surgery, colorectal, or a combination of all of these. So minimally invasive surgery can be very, basically mostly abdominal minimally invasive training, breast surgery, and this is typically breast oncology, hand surgery, burn surgery. These are all other alternative pathways. And some of these are ACGME accredited, but mostly they're non-ACGME accredited, burn surgery, for example. So other non-ACGME accredited fellowships that can be pursued, and these are, in general, it could be a variation of abdominal surgeries. Advanced GI, it could be a combination of hepatobiliary gastric surgery, colorectal surgery. Bariatric surgery is mostly weight loss surgery, and can be also a combination of others depending on the fellowship program. Complex gastrointestinal surgery, comprehensive flexible endoscopy. This is mostly surgical endoscopy. It can be stuff like ERCPs, POEMs, or peroral myotomy, and GPOEM, or gastric pyloromyotomies. Advanced surgical endoscopy, mostly foregut, but it also can be colorectal as well. Foregut surgery, this is mostly surgery of the esophagus and the stomach, benign and malignant, and the disease of the esophagus in general. And then hepatobiliary surgery, and in hepatobiliary surgery, disease or surgery of the liver, the pancreas, the bile duct, and some of these programs would have combination of other surgical diseases, other areas in the abdomen. But in general, there are many pathways that can be taken by the general surgeon after general surgery residency. There's 5 more I'll talk about here. So there's the hernia and abdominal wall fellowships. So hernia surgery became very advanced, and there's different approaches, different treating modalities. And now there are hernia fellowships, abdominal wall reconstruction fellowships. As the disease get more complex, there are recurrences, requires more further training, especially with the introduction of the robot and repair of hernias and other advanced modalities. There's also some non-ACGM accredited colorectal and advanced thoracic fellowships. And some of these non-ACGM accredited fellowships are very attractive for international graduates because they don't always go filled. Some of them become unfilled and it's easier to get into it. There are some acute care surgery fellowships is 1 year as well. By the way, I didn't mention, but the hernia surgery is 1 year. The hepatobiliary typically is 1 year. The foregut is 1 year. Most of these non-ACGM accredited fellowships after general surgery are 1 year. Bariatric, endoscopy, foregut, hepatobiliary, hernia, all of these are 1 year fellowships. And then there are some robotic surgery fellowships nowadays. And this can be a combination of what I mentioned just before, different kind of hernias, different foregut, different colorectal. So some of the robotic surgeons and centers are making fellowships for robotic surgery. And it's just an exciting era for robotic surgery now as it becomes more and more popular. It definitely has a lot of advantages over laparoscopy. 3D view, much better mobility within the abdomen, better dexterity, surgeon is sitting, decreased issues with physical pain from the surgery. It has a lot of advantages. And there are other fellowships like surgical education and other fellowships. Okay, so how do we apply to these surgery fellowships? There are 2 different tracks that I'm aware of. There may be more. But if you see all these fellowship to the left, advanced GI, bariatric, comprehensive flexible endoscopy, foregut, hepatobiliary, hernia, and some of these non-ACGM accredited colorectal and thoracic fellowships, you can apply through the Fellowship Council. There's a web page for the Fellowship Council. There's a timeline. We're going to go through it. And it's different from the usual ERAS application process. Then the list to the right and other fellowships, they go through the usual ERAS. Some of these include the complex general surgical oncology, fellowship badge, they do the ERAS, the breast surgical oncology fellowships, colorectal surgery, their main match is through ERAS, pediatric surgery, and some other fellowships. So now if there is something else in your mind that we didn't list here, you'll probably be able to search how the fellowship application goes through, as this is not completely comprehensive, but it's easy to find if you Google it. Then I'm going to go through some of the Fellowship Council pathways. So there's the advanced GI, bariatric, flexible endoscopy, foregut, and hernia. And then there are some non-ACGM accredited colorectal and thoracic fellowships. So if we go through the timeline for these non-ACGM accredited colorectal and thoracic fellowships, you see here, these are typically applied to the fellowship almost 2 years before the start time, meaning when you're on your 4th year of training and a 5-year training program and during your 4th year, you'll start applying. And let's say you're going to start in 2024, you would be if you have to apply 2 years before. So if you here 2023, So, no, sorry, for the colorectal and thoracic fellowship, it's not 2 years, but for the hernia, tract, MIS, and bariatric, it's 2 years. So let's go with the colorectal and thoracic. If you start the fellowship application August 1st, the fellowship application closes around November, and then you would do the rank order list in January. And then there is a scramble date if you do a match, and then they announce the fellowship match in January, and you're to start in August 2024. So this is a 1-year cycle for colorectal and thoracic fellowships. These are the non-ACGM accredited. Now, the ACGM accredited colorectal, if I remember correctly, it is also within 1 year. So you apply within your 5th year of training, and then you find out if you match or not. Unfortunately, if you don't match and you're applied in your 5th year, then you would have to do something else for 1 year and apply again. Okay, so go into the advanced GI, MIS, bariatric, flexible endoscopy, foregut, hepatobiliary, and hernia. This is a different application timeline, and it starts, say, December in 2023. The fellowship application closes in January. It tells you when the letter recommendations are due, and by January 26th, they tell you about your interviews, and eventually you get to know if you match or not in July, and then you start the year after, meaning in 2025. So you apply in your 4th year to actually start your fellowship after you finish your 5th year of training. Okay, so for the ERAS, we mentioned 2 examples: the complex general surgical oncology match, the breast surgical oncology fellowship as well. So the complex general surgical oncology application, you get a token for ERAS as usual. The application starts in November. There's a deadline, and then they get you the interviews in February, and you get the match results by June, and the fellowship starts the year after. So similar to the application for the fellowship council in terms of for MIS, foregut, and bariatric, you'd have to apply 2 years before to get to the fellowship after you're finished. So you apply through your 4th year, and you start 2 years, meaning after your 5th year. And then the breast surgical oncology, similar scenario. Application registration in December, then the interview notifications by February, then you get to the match results by July, and the fellowship starts the year after. Okay, so there are, before I start into alternative pathways for training, it is very important for you to look at some of the data from these fellowships. And with time, you realize some of these fellowships are more competitive than others. For example, surgical oncology is very competitive, and there are a limited number of training fellowships in oncology. And same goes on for example, pediatric surgery. We didn't mention anything about endocrine, but also there are some limited number of endocrine fellowships. So it is very important for you to check what is the field that you're interested in, what's their match, and what are the data in that match. A lot of the time, you would need to actually know somebody who actually did that, and they will guide you through the process. They'll give you more information about the match, when to start. You need to be connected with somebody who actually did that before. because this is very limited. It's not like the ERAS and residency. These are very limited seats, very limited number of programs that does this. And you need somebody from within to get into this. So having more information will help you definitely apply to through the right channels and get a position. Okay, so let's talk about some alternative pathways for training. So if you are trying to get some surgical training in the US, let's start with residency, for example, and you cannot get a categorical position. It's very competitive, or from the get-go, you apply for preliminary and categorical positions. Now, we all know it is very competitive. If you don't get a categorical position, at least you get a preliminary position that is 1 year guaranteed training. Then you apply again through that year. Now, if you don't match again, you can do a second year of preliminary surgery training. And hopefully after that, you can get a third year. Again, you apply, but there are some limitations there. If you're on a J1 visa, you would have some limitations. They may not allow you to get a second year again. So you need to advance. If you're a green card holder or a citizen, you can repeat the prelim year until you get a categorical position, for example. So it makes it easier on you. But you're on a visa, depends on what kind of visa, it could be a problem. I can discuss these if you have that scenario, kind of one by one, or at the end. If you do 2 years of prelim surgery and you don't get a categorical position, you can apply to certain fellowships. We'll come to that. But let's assume you are a general surgery resident who completed training in Saudi Arabia or elsewhere, and you want to pursue further training in the US, maybe residency, maybe fellowship. You can apply for accredited or non-accredited surgery fellowships. And they are generally easier to get than residency. If that does not happen, if you could not get an accredited or non-accredited surgical fellowship, you can apply for a clinical research fellowship that is combined with clinical training. So some areas or some hospitals or centers, they have like 2 years of training, 1 clinical research and 1 clinical training. And sometimes you cannot get these. You get a clinical research fellowship, you get into the system, you move to the US, you start making connections, they get to know you, they know you better, and then they give you an opportunity and they give you a position within their fellowship, within their clinical fellowship. I have definitely seen this over and over again. If you are within the US system, it is much easier to get a position. They will know you at a personal level and they will help you get something. Okay. Let's say you did get a clinical surgery fellowship. At that point, you complete your surgical fellowship and you apply for residency or another desired fellowship. Sometimes you don't get the fellowship that you wanted the first time, so you get something else and then you apply again. You complete that and you apply again for your desired fellowship. It definitely requires a lot of patience. It requires a lot of effort, but it's worth it at the end. And if you saw, I did a burn fellowship. That was not my goal. It definitely helped me a lot. Made me a better physician. It made me a better clinician, better in a lot of aspects of my life. Gave me a lot of clinical independence early on. So don't take it as a negative. Sometimes you take something that you did not initially want, but it has a lot of help and impact on you as a physician. Okay, so what else? So sometimes, like I mentioned, you did a prelim year or 2, in an ACGME accredited center or residency, but you did not get a categorical position as a third year. So what do? You apply for these fellowships or others like burn, hand, critical care. And this is a well-known thing in the US. Sometimes residents, after the second year of training, they go for a research fellowship, especially if they were trying to get into a competitive fellowship like pediatric surgery, plastic surgery, or surgical oncology. But typically, residents within large academic programs will take a year or two for research, have certain publications, and have a name within the field. And then it would be much easier for them. They would be much more competitive as a fellow in these fields. So they take a gap of 2 years, and then they go back to residence. In a similar way, some residents decide not to take a research fellowship, but take a clinical fellowship. And this could be a critical care surgery fellowship, could be burn, could be hand, could be others. And that will help them. If somebody does a burn surgery for a year, and then they plan to do plastics, it will help them match into plastic as it's very relevant to the fellowship. Okay, what other alternative pathways? So some prestigious fellowships have international positions. For example, when I was doing my rotation at Memorial Sloan Kettering, during my surgical oncology training, I saw some of these international fellows, and they have one or two international fellows each year in the Memorial Sloan Kettering Surgical Oncology Fellowship. And this is one of the best surgical oncology fellowships in the US, maybe in the world. And if you get as an international candidate, if you get this position, you definitely have a lot of training experience, and it'll make you definitely much better as a physician in terms of exposure, in terms of level of complexity of these cases, exposure to research, and exposure to very innovative training or treating methodologies in centers like Memorial Sloan Kettering. I put in the bottom some pictures taken from Memorial Sloan Kettering website. It shows they talk about this international pathway. They also have an international surgical oncology fellowship. So it's not only just surgical oncology. Also, the Cleveland Clinic, where I did my bariatric surgery fellowship, they have a position for international fellows in colorectal surgery. Again, the Cleveland Clinic Colorectal Fellowship is one of the best fellowships in the US, again, maybe in the world. It is very, very good fellowship. They have a full, within the digestive disease and surgery institute, there's general surgery, colorectal surgery, and then the gastroenterology department. And they have, I assume, 20 of the staffs in colorectal surgery. You have a lot of exposure to variety of benign, complex surgery. Again, exposure within these institutes is exceptional, to say the least. So you can get a very good training by applying to these institutes if you can get these positions. Sometimes they take you for research for a year, and then they take you as a clinical fellow. So it's important to stay, patient and enter the system and then apply. Okay. So there are other pathways and other ways to get some of these training positions that are not typical. So the American Association of Program Directors in Surgery, they have a webpage for open training positions. And I took this opening today from their website. It's for surgical critical care fellow at Lincoln Medical Center in New York. You can see the posting is September 25th, very recent. And they mention what this, and they talk about Lincoln Medical Center or what this hospital has. And they typically within these listings, they will say what is the requirement for the fellow. So in this case, trainees who have completed an ACGME approved general surgery training program or pediatric surgery training program are preferred. Consideration will be given to highly qualified individuals who have completed 5-year general surgery ACGME accredited program or DO program. Sometimes you would have, it would be a requirement to have completed the general surgery training in the US, but sometimes also it would be 2 years of ACGME training, or could be any general surgery training anywhere, not necessarily an ACGME accredited. So basically you would need to check on the American Association of Program Directors and Surgery website, every other day or every week to check for these positions and apply as they come. Okay. Sometimes you actually go to the US, complete a surgical fellowship, clinical fellowship, and then you have a chance to apply for residence within the US. But if you do a surgery fellowship, sometimes you can get into general surgery training, but as a senior resident, as a PGY4. Now, this is, you have to be somewhat lucky to get this, but it can happen. I have seen it with few people that I know. So they did the fellowship, then somebody dropped as a PGY3, and there is a PGY4 position available in that institute. For them to fill that position, they need some senior surgeon or some trained surgeon to an extent to fill that position. And for somebody who has been trained outside the US in a non-ACGME accredited program and completed a year or two of clinical training in the US, it makes it a case for the program director or the chairman of that department to send his application to the American Board of Surgery and see if they would allow them to take him as a PGY4. And this is approved in a case by case, but I have definitely seen it happen maybe 2 to 3 times. And if it works, it's excellent. You have got a fellowship training and you're starting your training in the US as a resident, as a PGY4. So you spend 2 years with them and you're all set, you sit for the American Board of Surgery. It's very important that you keep an eye also on these PGY4 openings. Again, you would go to the American Board of Surgery, American Association of Program Directors and Surgery. When you're in your fellowship, always checking for these PGY4 positions, and you apply for them as they come, in hope that you actually complete your residency training and sit for the American Board of Surgery certification. There is one more way, but this is for more advanced academic surgeons. And this is available in the American Board of Surgery website. They talk about it. It's the academic pathway for ABS certifications for IMG. It's an alternative pathway into the American Board certification for truly exceptional academic surgeons. So these surgeons, they trained outside the United States in non-ACGME accredited programs, but they can be eligible if they have spent few years, meaning these surgeons probably did a fellowship training in the US. They were hired in their institute and they gained a license through that institute for that state because they're exceptionally talented surgeons. So they're giving that opportunity to actually practice by just the surgical fellowship. It's a limited license. They're not board certified. So they practice, they publish research, and they're well trained from their homeland, but they did fellowship in the US, became much more trained. They continue to practice that specialty or within that fellowship. At one point, after a few years, if they continue to do exceptionally well, the chairman of the department or the program director can send their application for the American Board of Surgery for certification. And I have seen that happen too. It is definitely for only exceptional surgeons to be certified by the American Board of Surgery. So they sit for the American Board of Surgery. They take their boards without residency training in the US, but they have practiced in the US and proved to be exceptional in terms of research, academia, and clinical practice. So that's the only way I know that you can sit for the American Board of Surgery and be certified without doing a residency in the United States. Okay, I think this is all I got today. So in conclusion, so fellowship training in the United States is attainable. Apply early. Some fellowships require that you apply when you are on your 4th year of training. Some within your 5th year of training. Again, they consider early applications more. Find a mentor to guide you through the process. Learn the match process for each fellowship. You need to know somebody sometimes within that, clinical fellowship area to help you through the process. Some of these seats are very limited. I mentioned an example, maybe endocrine surgery has 12 fellowship training positions in the US, something like that, very limited number. So you need to know the scope, you need to know the statistics of that fellowship that is you're desiring. And there is always a way, if you are interested and patient and move to the US, make the connections, do your research, you will eventually get the position that you wanted. And with that, I thank you all, and I'm happy to answer any questions, receive your questions even after the session on my personal email, and I'll give it back to you, Safia. Thank you.
Thank you very much for the informative presentation, Dr. Shamia. It was great to learn about the different advanced fellowships in the field of surgery. Thank you for sharing your valuable advice with us. We're certain everyone found it just as beneficial as we did. To everyone in the audience, thank you for joining us for this webinar. If you have any questions for Dr. Shamia, feel free to unmute yourself or put them in the chat.
Okay, so I will go with some of these chat questions. So, Sulaiman, currently medical student, Shamia, medical student. So most of the audience, I assume, are medical students. Can I do residency in Germany, for example, then do a fellowship in the USA? Of course you can. Is this pathway easier than doing residency in the USA for orthopedic surgery? Yes, there's probably easier in terms of orthopedic, but this is if you're not planning to practice within the US. If you're planning to practice within the US, it's better that you do a residency in the US. If you're planning to practice in the Middle East or somewhere else, of course, doing a residency in Germany is probably easier than the United States if it's a very competitive residency like orthopedic surgery. Now, I have to say, I don't know how hard it is to get orthopedic surgery in Germany, but from what I hear, it is easier than the United States. Okay, next, do you have any advice for us at this stage as medical students who are interested in surgery? Of course, I have a lot of advice. So you need to do well in your school. You need to prepare for the USMLE as early as possible. So I would say start preparing for the USMLE the first day you're in med school. So you prepare for the step 1 while you're taking your basic sciences exams. by the time you finish your basic sciences, within 3 to 6 months, you should be able to sit for your step 1, especially that is pass and fail now. Then once you finish your clinical rotations, you should be able, within again 3 to 6 months, you should be able to sit for step 2 and then become ECFMG certified. From there, you can take further steps towards residency, surgery residency in the US. Like I mentioned before, apply for prelim and categorical, try to do some clinical rotations in the US, maybe research in the US, and then you accept a prelim surgery position if you cannot get a categorical position. And from there, you move on slowly, but you can get into the system as a prelim much better than somebody who's not in the US. Okay, for liver transplant, do you know if there is another pathway other than hepatobiliary? And for cardiac surgery? Yes, so Basil, so there is a pathway for liver transplant or abdominal transplant right after general surgery. So if you do general surgery in Saudi or anywhere, or in the US, you can go for liver transplant straight away. There's no need to do hepatobiliary. In fact, a lot of the hepatobiliary surgeons or who want to practice hepatobiliary surgery, they do some liver transplant training as well to make them much more competitive and much more skilled as hepatobiliary surgeons. For cardiac surgery, yes, you can also apply for cardiothoracic surgery after general surgery if you did it in the US or outside. However, cardiothoracic is probably more competitive than transplant. Transplant as a fellowship is very, very hard. You almost have no social life for 2 years. And as such, I know it can go unfilled sometimes. For cardiac surgery, is it better to join a cardiac surgery program directly or general surgery than do a cardiac first? Honestly, I'm not the best person to answer this question. It needs to be somebody who actually within the cardiac surgery field to answer that. One of my friends, Luqman Muhammad, he is doing his cardiac thoracic surgery fellowship in Beth Israel, Harvard, one of the Harvard affiliate hospitals. He's also from my class. You can probably approach him and ask him. He probably has a better answer than me. How can we apply for a research to be a research fellow? Dalal. So there are a lot of research fellowships. If you go to most of the academic places, you'll see that they have research fellowships. You can directly approach them and send them email to whoever is posting that research fellowship. You can check the American or the Association of Program Directors in Surgery webpage. They also post some research positions. You can also network and ask some of the prior alumni from Alfaisal about any research positions they're aware of. So you want to try to contact as many people as you can to get a position, especially if you're looking for a paid position. Unpaid positions are much easier to get. Okay. Next, what are the minimum of researches you need to increase your chances of matching into a categorical surgery residency? There is no minimum. There are people who match with no research. There are people who match with a lot of research. But it is your full application. Doing research definitely help. Doing other clinical rotations, being very good in your rotations, having excellent letters of recommendation will definitely help you. So there is no minimum or maximum. It's the full application. Of course, doing more research, more publications will help more. Being an IMG, is it wise to pursue a general surgery residency than a neurological surgery? I don't see that as wise. If you want to do neurosurgery, from the get-go, probably pursue a research fellowship in neurosurgery field Try to be around neurosurgeons. Leave the general surgeons alone. They're not the best to help you to get a neurosurgery position. And there are some of the prior alumni from Alfaisal who are in neurosurgery now. I remember Hassam. There's another one from the other class, I forgot his name. He's in Florida. But you can approach the alumni from Alfaisal who are doing neurosurgery residency in the US now. That's your best way to actually get a position, get to know the folks within the field, maybe get a research position, and then they'll help you and guide you through the process. Are there any prerequisites for international residency graduates that are planning to do fellowships in the USA other than USMLE? So you need to be ECFMG certified, meaning you do the USMLE and become ECFMG certified. Generally, no other prerequisite. Generally, no. It's just the ECFMG certification, and there are a lot of positions. It is much easier to get a fellowship in the US than residency in the US. And once you get a fellowship and you complete your fellowship, it is easier to get into residency. So in general, and this is, by the way, also true for internal medicine. I did not mention this. This is a way to get into a residency in internal medicine in the United States. If you did an internal medicine residency, for example, in Saudi Arabia or elsewhere, you can apply for a fellowship in the United States, and some of these fellowships that get unfilled, like nephrology, infectious disease, and others, and then complete your clinical fellowship. It would be much easier for you to go ahead and finish a residency after the fellowship. And sometimes you did not even complete a residency in Saudi Arabia or elsewhere. You just completed a few years of postgraduate training, and they will allow you to take into a clinical fellowship in medicine. And I have seen that happen. So it is very helpful for you to start in the US as a fellow before resident if you're struggling to get a residency up front. You're welcome all. It is my pleasure, and I am here in Saudi Arabia. So if you guys need anything, I'm happy. We have the same time zone. You guys can ask, and I'm happy to help you.
Thank you, everyone. Make sure to register for our upcoming webinars under both the Career Guidance Series US Residency and Fellowship Series. You can scan the QR code on the screen for the registration link. Also, make sure to follow us on Instagram and Twitter, and subscribe to our YouTube channel to receive the latest updates about all our upcoming events. Just before we end, I'd like to share with you a few links that will lead you to Alfaisal MedHub social media platforms. Thank you to Dr. Shamia and everyone in the audience once again, and we hope to see you again in our upcoming webinars.
Thank you.